inviting me here this morning. Um, so everyone, I'm excited. We've got looks like a smaller, more intimate group. And so today, as I'm talking, feel free to be cameras off, silent, and also feel free to come on and join if you'd like to. Um, Today, I'm going to be talking about some tools and concepts I utilize in my practice. And along the way, if you have questions, you can put them in the chat. Throughout my presentation, I'll stop and solicit questions. And then, of course, at the end, we'll open it up for Q&A. So start with me. My name is Scott Miller. I'm a social work practitioner and a social skills specialist here in Northern Virginia. I provide group psychotherapy and individual social skills consultation to clients across Virginia. So today I'm going to talk to you about something that I'm passionate about, and I'm going to talk to you about social skills or interpersonal effectiveness. And it's my opinion that social skills are essential life skills. They're foundational for healthy functioning in every stage of life, from childhood to approaching mortality and end of life. Research demonstrates that meaningful social relationships, which are the product of interpersonal effectiveness or social skills, is a protective factor for all kinds of mental and physical illness, and is the most consistent factor in determining happiness in adulthood, more than IQ, professional status, genetics even. And so this sets up kind of my motivation, my passion, is the ability to connect and make relationships. Today, I'm going to talk to you about two tools or concepts that I often will utilize in my group therapies. I teach as tools for people that navigate anxiety or even struggle, just how to start or join a conversation. In addition to that, I'm going to talk a bit about the groups that I run. And when we have our Q&A, I'll kind of also invite questions about the group, the process, who might be a good candidate for those groups, including children or even adults. And if you were interested in that, how you might access that resource. Okay. Before I go into tools or concepts, everyone, I want to take a moment and I want to invite y'all to reflect a minute. And if you want to close your eyes, feel free to do that. You know, you got your camera off, you're safe to close your eyes. I'm going to leave mine open, but I might kind of gaze off for a minute. And I'm going to go back to grade school for a minute. And I want you to go back to your grade school experience. And I want you to imagine the elementary playground or the grade school playground, and kids are running and screaming. And for a moment, I want you to picture the child that's maybe sitting on the bench or sitting off to the side. Maybe he's wanting to go swing, but it's not available. And if this child is familiar to you, if perhaps it was you or you know this person intimately, you might notice a rapid heart rate. You might notice a nausea. You might notice an experience of feeling overwhelmed by the stimulation of the day, the noise. Perhaps let's consider another child who's on the playground and wants to join in, but is hesitant about how to do so, or even if they would be received. And so they don't, and they stay on the periphery. And there's another child that I have in mind, and this may be you, or you might know this child, or if you can think back to that elementary playground, you might have seen this child who's excited and who actually is very excited to share and join in and jump in. But when they jump in and they kind of bulldoze the conversation, or they want to share about their favorite washing machine, or perhaps they tell you about their favorite movie, but they don't stop. They don't offer a room for the other person to join in. And this might be what you saw on that playground, some of these kids. If this was you, you might have known what that felt like. And then sometimes I'm going to bring you now into my office, and when I have people kind of be open with me and young children open with me. And oftentimes people that have this experience of struggling to join in, wanting to join in, but can't, or are motivated or willing to join in, but it falls on deaf ears. often the result of this is feelings of self-doubt, of low worth, of questioning why can't I join in. And when I understand the impact on an individual level and on a systems level, this motivates me. Because for me, I was one of these children that barely spoke, that struggled with clinically significant social anxiety. Some people didn't know if I spoke before I was in 4th grade. I would be called names like alien boy, what's wrong with you? And it's distressing. And so this creates an organic motivation in me. And the more I work with groups of people, not just children, but adults too, the importance of the work continues to manifest in it. This is my motivation. This is my excitement. And so this is what brings me here today. All right. Now, if you closed your eyes, come back out of there. If this brought up any memories of you of seeing that child, perhaps being that child, take a moment. Let's reset back here today. All right. So my intention today is twofold. I want to offer some tools or concepts that I teach in my individual consultations or my group therapies that you can take out of here today and utilize yourself or with. Okay, great, Raphael, great question. So let me do this. No, let me pop in. So this is a great time for that question. So actually I'm gonna pause here and respond to that. So clinically significant. On a layman's level, it would be, does anxiety interfere in social, professional, or academic functioning? To meet criteria for a diagnosis, there's a handbook called the DSM, the Diagnostic of Statistical, you guys put me on the spot. I'm gonna call, I haven't spelled it out in a while. I've got it somewhere over here, but the DSM is this handbook that gives us criteria specifically to reference in diagnosing mental disorder. So to just, if you're wondering, hey, do I have clinically significant anxiety, my child, an easy kind of eyeball test is, does anxiety interfere with social functioning, academic functioning, or professional functioning at work? If that's the case, you likely meet criteria for a anxiety disorder. Now, I don't recommend the Google diagnosis, but so reaching out to a therapist, even a general practitioner, if you've got a family care doctor, they've got enough of a base knowledge to give you that feedback or refer you to someone who can give you a formal diagnosis. Raphael, did that response kind of address that question? And you can throw that in the chat, yes or no.
Or you can unmute yourself.
Awesome. Okay, thanks, Raphael. So now I'm going to move here, and today I'm going to talk about 2 different concepts, tools that I use in my practice. And the intention is for you to be able to take this out of here today, perhaps apply it for yourself, or perhaps utilize it with your child. Now, if your child is involved in an intervention or therapy, this is a great supplement tool. If not, this might be an aha moment and says, okay, this is helpful, but I might also need some professional support. And if you have questions about that, we can definitely, when we get into our Q&A at the end, talk about how to access support. What does support look like? Any questions about intervention is open. Okay, so the first tool that I'm going to bring up is called the JENS method, and it's the JENS method for making meaningful small talk. This is an approach that was developed in conversations with my wife and I, Anna Miller, who's also a social worker. And so what I'm going to do now is I'm going to pull up my handout that I referenced, and I'll share my screen. And that way, as I'm talking, you can see kind of this tool that I use to reference the JENS method. Okay. So now I'm kind of looking down at my computer for a moment, and let me see here. Boom. All right. And now I'm going to come back to Zoom and share my screen. Okay. And so, Jan, for a moment, give me a little bit of feedback on how that's coming across to you on the screen here. Good. Okay. So why do I use this? Why do I teach this? Because for some people, there's organic anxiety, and then that makes conversations hard. For other people, anxiety is manifested because they struggle to initiate conversation, or when they have, it's not gone well. Or perhaps you're a person or you know a person with autism spectrum. And so you miss some of the organic social cues. And so social anxiety comes later on when you have repeated difficulties making contact. And so the GINS method is an acronym, GINS, and it stands for greetings, interest or take an interest, names, and salutations and goodbyes. It's four-stepped, it's simple, and it's something that a lot of kids and even adults I've worked with like. It's simple, they can reference it, and they've been able to actualize it. When we can debunk things, when we can simplify things, it often removes some of the anxiety around it. Now, the GINS method is a reference for making meaningful small talk, and I'm also developing it as a gradual exposure tool for social anxiety. And I'll talk more about that. But while I'm doing this, I might even reference the idea of exposure. Because if you or your child has difficulty making contact with others, no matter what therapy you get, the underlying intervention for anxiety is exposure. And so any intervention is going to have to utilize exposure to treat and reduce anxiety. Okay. So let's talk about greetings. Greetings create opportunities for connection. Now, in this reference, greetings are going to be something that I encourage if you're teaching your child this method, that we're going to encourage to do with anyone that enters your vicinity, which I define as being within earshot of a typical conversation. So an example of this vicinity might be walking to the same room as somebody else. If you're in your yard and somebody walks by and you don't have, acre and a half plus, you're in a typical suburban Virginia neighborhood, then it would be greeting them. If you're walking down the sidewalk with the family and someone passes by, they would be within your vicinity. Now, a level 1 greeting I think of as eye contact, smile. Some people give a nod of the head, I'm one of those people, or a wave, perhaps both. Now, if you notice, with children and with adults, I will specifically teach this instruction, greeting. And if we talk about exposure, we're going to work on greeting anytime anyone comes within our vicinity. By doing this, we normalize it, we reduce the anxiety over time, and we can even modify this exposure by starting with just inside our own house. When mom or dad walk in the door, when I come out of my room and my brother's there or my grandma's visiting, I look up, eye contact, smile, wave. Explicit instruction. So we're going to talk about the ways we're teaching. So if this is for self, you're getting explicit instruction from me now. If this is for a child or someone else, the most powerful tools for teaching or children are going to be explicit instruction and mimicry. And so if you're reading this and you're noticing that when the neighbor walks by, you drop your head, this might be a cue that we need to do some work ourselves here. Okay. This next level of greeting would be verbal. And I would explicitly teach phrases. And I would even invite the other person I'm talking to think of what they might say or what they like to hear. Hello, what's up? Morning. Or the greeting of the day. And the thing about the greeting of the day, y'all, is this is universal. In every language, there's a greeting for the morning, there's a greeting for the afternoon or the evening. And so no matter what language, even sign language that you're teaching in, we can teach a greeting for the greeting of the day. To me, this is a little more difficult because if you have social anxiety, you might get that muscle contraction in your throat. You might make it hard to speak. And so that's why we start with the nonverbal, up, nod. Okay. This level 3, whether you want to think of difficulty or challenge or just the next step, would be if you know someone's name, to greet them by name. If we go back to the house example, good morning, mom, good morning, bro, good morning, sis. If it happens to be an adult that you're familiar with for children, it might be in the teacher. Yeah. Good morning, Mrs. You name it. Okay. Similarly, if you're an adult and this information is striking you, it might be greeting your partner by name or family members by name. It might be greeting the neighbor by name or a coworker by name. But again, with anxiety, we don't want to overwhelm. So you start with the exposure that would induce anxiety, but not overwhelm you, which is why we start with the level 1, eye contact, nod. Okay. So when we talk about making meaningful small talk, greetings are someone you can do with anyone. Now, this method is very clear. There is no expectation that everyone you greet is going to turn into a conversation. In fact, that would probably create a social deficit in itself if you try to talk with everybody that you walked by. It's not the case. We're just greeting people that walk in our vicinity. And I explicitly tell people, expect other people not to respond. And if that causes doubt, we hypothesize why that might be. Do they have headphones in? Are they nervous themselves? Have they been taught not to talk to strangers? All these are acceptable and reasonable. They don't have to prevent us from practicing. Okay. So interest or take an interest in the other person is the next step to making meaningful small talk. And whereas with the greeting, I recommend doing this within anyone that comes within conversational earshot or within your vicinity, interest is something we're going to do if we remain in the same vicinity as someone for 30 seconds plus. I'm giving you a discrete number. I usually say for a bit longer if you find yourself pausing. An example of this might be waiting for the bus, sitting on the bus, waiting in line, at the dog park. Dogs are running and you're standing around someone else's. In the home, this might be in the living room when the TV is not on. It might be at the dinner table or the kitchen bar. When we're around and we're in the same vicinity, it opens up a place to have more than a greeting, okay? And like I mentioned earlier, for some people, I will explicitly teach that we don't want to try to start a conversation with everybody we walk by. A nod and a wave is good. So take an interest in another person. If we learn how to take an interest in other people, we can talk to anyone in the world. You can talk to someone experiencing homeless and mental illness. You can talk to the Queen of England, who also might be experiencing mental illness, because this is a universal experience. But my point in saying that is, no matter what state someone is in, if you take an interest in them, you can engage. And so how do we take an interest? This is going to segue into another piece that I'm going to talk about tools that's called parts of conversation. And this is something I teach explicitly. But the simplest way to take an interest in another person is by simply asking a question or commenting and asking a question. Cool shoes. Yeah. Are you a runner? Right? Your flowers are looking really nice. What have you done this year? I haven't seen you in a bit. How are you? Now, the phrase, how are you, is something in my practice I teach to be mindful of. If you don't want to know how somebody is, don't ask them, how are you? And that's something you'll notice that I intentionally practice. I spend most of my days intentionally asking that question. So with my neighbors, I don't ask anybody, how are you? And it's something that is often said in passing, but then it kind of creates a weird, if you're just having a brief exchange, say, how are you? And somebody goes to tell you, it's a little disconnected. Or vice versa, if you just say that phrase and don't ever mean it, then then that also has a way of rubbing people. So I teach to use that phrase intentionally. Be ready to listen openly, perhaps sit down when you ask, how are you? Okay. When I'm teaching, I don't just teach explicit questions or phrases. I invite a conversation. We brainstorm together. And so adult learning theory would say that when I talk to an audience, I would also invite you and get you to engage. It would increase your learning and take home. So I want to invite that for a moment. If someone would be willing to speak out loud or throw something in the chat, and let me make sure I can see the chat. I don't know if I can. Actually, I can't see the chat. Is anyone bold enough to unmute and throw me an idea of a basic take an interest question? And I'm gonna go to my audience, but perhaps Jan, if no one else will, you'll engage with me. Does anyone have an idea of a take an interest question, what you might use? Oh. Okay.
Jason says, can I help you?
Ooh. Now, Jason, this is a good idea, but this is another one I say it with intention.
Yeah.
Can I help you? So I'm also mindful that if I say it, I'll make sure I'm ready to engage or be helpful. But yeah, can I help you? Mm-hmm.
Joy, you're good at this.
Yeah.
No, I was just thinking like to engage with people with weather. It's kind of something that's easy to to start with. Like today's a beautiful day, don't you think?
Don't you think? Yeah. Today,
I'm just kidding.
yeah. What are you going to be doing? Yeah. What are you getting into this weekend? Yeah. The weather is often kind of it's a reference, and social skills circles to kind of laugh at it, but it is old reliable.
Yeah.
Right?
And someone said, where did you get that shirt?
Yeah, where'd you get that shirt? Yeah. When I think
a lot of comments too, like you said, saying I like your shirt, or giving compliments is really
good. And so compliments are what I capture into a comment, and a compliment is a great initiator, Joy. Dale Carnegie, who wrote a book, I think back in 1924, called How to Win Friends and Influence People. One of his main social skills is start with a compliment, lead with a compliment. Yeah. So take an interest, comment, ask a question. It might help if you struggle with this to brainstorm or even ask, people that you live with, what might you like to be asked? Pay attention to other people that are more socially active and learn. If I'm working with a child or an adult, I might give some offers, but we would also brainstorm together. What have you heard? What do you like to be asked? What do you not like to be asked? Yeah. And then it's the exposure piece. We might specifically think about places where they're mingling or around other people to break the ice. With kids, often it is at school waiting for the school bus. Perhaps even if they're very reserved and don't even talk to family, we might start with making small talk with mom and dad or a sibling or an extended family member. Okay. This also gets into the exposure protocol, right? We start with greetings, we move to taking an interest. Another thing that a lot of people with social anxiety like about this is when I work with people with social anxiety, it's often when the attention is on them that the anxiety flares. And so by learning how to take an interest in others and initiate these questions and on-topic follow-up questions, it removes the focus from self and just disperses it to other people. Okay, we've talked about greetings, we talked about interest. And now we're going to shift to names. And we're talking about making meaningful small talk. Similar to with greetings, anyone within your vicinity we greet, to nonverbal to verbal. Interest, we take an interest in someone that we're in the same vicinity for maybe a minute, 30 seconds, longer than that. We're standing around near them. Okay. Names, it is not socially acceptable, it's not typical to share your name anymore with everybody. And this is okay. So here's my reference. If the taking an interest turned into a pleasant interaction, And it's a space where you're likely to re-interact with this person, work, school, neighborhood, community. It's an appropriate time to say, hey, I enjoyed talking to you. It was nice to meet you. My name is Scott. What's your name? Some people that I talk to feel like what's your name is too forward. So using a phrase such as, is it okay if I get your name? Feels more comfortable. This protocol is not meant to be rigid. In fact, it's meant to be flexible and principle based, to adjust and tailored. I offer this sheet to you, and sometimes that's part of the professional skill set in studying something specifically. If you have trouble tailoring something, or you're finding that you're reaching a wall, that might be a good time to reach out for support or more consult. Okay. And now we shift to salutations and goodbyes. I specifically indicate goodbyes because salutations is just used for greetings or goodbyes. Okay. Now, this is something, and when we're using this, I'm referencing persons with anxiety, maybe difficulty recognizing social cues, making small talk. This is also something we can teach to neurotypical children to socialize appropriately, especially in the world of disconnection, especially in the world of virtual engagement. I have a 3-year-old daughter, and she has a very hard time saying goodbye. She's a great saying hello. She loves to play, but she has a little hissy fit when she has to say goodbye. And so this is applicable for this approach in lots of situations. So in this setting, with my daughter, I use explicit instruction. I pull her aside. And now we're talking about how to teach. When we teach our children, or even in a therapeutic setting, the best way we receive is when we feel understood and we have an empathetic listener. And so I don't yell at my daughter or give her criticism in front of everyone at the playground or with her friends. I pull her aside. I come down and I say, hey, look at me. And that's usually the first step. I need her to look at me because usually she's head down. Once she looks at me, I say, can you hear me? And I know she can hear me, but I'm looking for the verbal engagement, which initiates her ability to listen and hear me. And then I say, hey, when you yell and fuss, it's not fun to be around. And you've made good friends today, but when you behave this way, you're likely going to push them away and they might not want to play with you anymore. I want you to go over there and say goodbye. And I might get some pouting, and I stay with her. This takes energy and attention. I cannot do this all the time, but I'm intentional about doing this because I know how pivotal these skills are. And I send her over. Okay. Now let's come to our person with anxiety. If you have a child with anxiety, you yourself experience this. Perhaps you've been in a social interaction, you've engaged intermittently, but when it's time to go, your kind of head just dropped and you shuffle away. This is the parting impression we leave on people. And so I specifically teach this. Look up, smile, wave. And again, that another level, that would be the verbal. Goodbye, it was nice to meet you. Perhaps I'll see you around. Maybe I'll see you at the next game, right? Okay. So I want to take a moment here. I want to come out of screen share so I can see the chat and see all of y'all more fully. And I want to invite questions, thoughts on the JENS method for making meaningful small talk. Okay. So I'm going to stop the screen share, and that way I'll be able to see your chats. Oh, got you, Jen. I see that. So I just saw that now. You couldn't see all of it. Good.
You scrolled down, so everything was good.
I would say, have one question. Work with a lot of teens and adults, and sometimes when they're, of course, meeting people for the first time, that wanting to give out that phone number or their information before they even get to know the person. So I'm constantly encouraging them to get to know them first, see how that goes, but sometimes that can be difficult because they want to be connected right away and give out that information. So.
If to that, Joy, I could look at that from a couple perspectives. One, I'd say, is that causing issues for the kid? Are they doing this and they're coming across as jealous?
Right.
So, and is that the case in some of the people you're thinking of?
They're coming out. I'm sorry, say it again.
So
Two.
is that energy of wanting to exchange immediately, is that causing them problems socially?
Um, yes. Well, then there's also some people who get that number and then call them multiple times. So the parents are like, I don't really want you, I don't want them to do that, but they might not be there. That's up to them to decide if that's going to happen or not. It's just, doesn't always happen that they don't give out they don't, other people know, well, I'm not going to give you my number until I get to know you. They're already doing that, but then some people do. So it's just sometimes for, I guess, just trying to help them with that and understanding that, get to know the person possibly first before you ask, the phone number and things like that. I don't know. What is your suggestion to that?
Well, I'm going to give you this classic therapist answer. It depends.
Yeah.
I had a graduate school teacher and that we knew when it was coming. It depends.
Yeah.
Sometimes a child is telling me that this is causing, disinterest, or they're doing that and it ruins the engagement. Other times a parent is telling me.
Well, that can too. Yeah.
Yeah. So if that's the case, I would use that as the natural reference. Hey, it seems like this isn't working. And I would dig into it. And typically then I would talk about when you're soliciting a number, getting a number, let's try to find a rationale for it. So like if I'm just in the neighborhood and I meet somebody, if there's not a reason to get the number, it comes across issue. You're like, whoa, why do you want that?
Right.
Now,
we wouldn't do that. Yeah.
If I meet someone, example here, I've got a large dog, and with COVID, our neighborhood dog park is like, there's never a time when I'm finding someone to go out there. So I interacted with a neighbor who had a large dog, and we had small talk. And hey, my dog loves to run. They seem to get along. I come out here more in the evenings or the weekends. Would you like it if when I do that, I text you or
Yeah.
They said, yeah. Okay, cool. Here's my number. Can I get yours?
Right.
That was a rationale and an intention for that.
Right.
Now, if I'm just out soliciting phone numbers at the dog park, that might come across as strange, weird, or my wife might be concerned about me.
Yeah, exactly. Yes.
Let's talk about a different perspective. Let's talk about a safety issue.
Right.
Talk about, now you might have different ideas that come to mind when you think of someone that struggles socially, but this occurs across the spectrum. I work with high-level athletes that are aspiring Division I athletes in college that have profound and significant social anxiety. And part of the trouble is they're not in the category in people's mind's eye of what should be expected. So when they have a panic attack at the track meet, when they leave in the middle of the basketball game, there's a whole nother level of stigma because they're big or strong or athletic. So I encourage you to keep an open eye, an open image when you think of someone who's struggling socially.
And Scott, I don't know if you saw it in the chat. Do you have any recommendation for a child with verbal limitation?
So one, would want to clarify this. Is it, and having a clarification on what that is. Is it a developmental delay in the comprehension vocabulary is limited? Is it a speech issue? And so depending, in my experience with speech issues, the speech issue is the organic issue. Anxiety tends to become the predominant issue. And so there's layman things that we can do at the house that are regular. When I'm working clinically with people, some of the most important things I can do is find regular pattern things that we can do in a family system that are going to promote what we're doing. Reading out loud is a low-cost intervention. Reading out loud in a safe place with someone that is pleasant and that we enjoy being around, a parent, hopefully, siblings, depending, maybe younger siblings. So reading out loud is a great way for a child with a speech limitation to improve their confidence of speaking. Oftentimes, speech issues manifest into pretty significant social anxiety because we're chronically aware of how we're coming across or if we sound funny. So you're gonna hear me say it depends, but I'm gonna try to respond if you can clarify for me. Jason, any thoughts or questions on kind of how I responded to that question there? Good. And that's not the end all be all, but that's one of the low tech interventions, reading out loud. Something that was significant and profound for me as a child was a reading buddy system. And where I was teaching first graders, I was reading with them. And though I barely spoke, I had a very, my verbal comprehension and I actually could read silently very well. And to be asked to help someone else, it put me in this different position and also let me know that I had some skills. All right. Other questions about this method or this protocol for making meaningful small talk? All right, I'm gonna segue. And before I transition, there's a piece, Joy, that you were talking about the exchanging numbers. So I spoke to the part of having a rationale or intention. The other piece of that can be the safety issue, right? Of giving out our numbers. And so this is something that one, I would encourage parents to explicitly teach with the understanding that your kids are going to do it. Sometimes parents, they get hung up because I try to discern between your principles and what you're teaching and your values and your expectations. I expect my teenage children not to drink or have sex or drive under the influence. Being a teenager, working for the last decade with teenagers, I know that that's within normal development. And so I want to teach what I expect. Do not forget the power of telling your children what you expect of them, what you want for them. And at the same time, having reasonable age appropriate, cognition appropriate expectations. Okay.
Scott, Joy is our recreation coordinator here, so she deals with a lot of individuals, both teens and adults. And sometimes she's dealing with things that the parents don't always deal with. So, and I want to say she does a fabulous job at that, so.
Thanks, I appreciate it. I was also going to say something about hugs too. That is huge for people who want to greet. They want to hug right from the beginning, and that's not even knowing the person either. So that can be a challenge in helping them get through that, with parents too, helping going through the parents or the caregiver to kind of help them with that too.
When I think of something like this, and some of the people I've worked with, I encourage the parents to continue to teach what they expect.
Yeah.
Also, I think about the swimming method, how to teach children how to swim. And I'm not talking about throwing them in the deep end, because that works well. But I'm talking about being in the pool with them, holding them, giving them floaties, a gradual exposure, right? Sometimes we have to let our children flop or flail, though, within a safe environment. And even the parents who will throw their kids in the deep end, I'm not totally opposed to it, as long as you're a strong swimmer and you can maintain their safety if they don't come up. We want to be mindful, though, of what the damage could be. You got to know your child to do that.
Yeah.
So in this setting, Joy, when we think about someone who hugs a lot, sometimes the teaching, hey, that's not okay, or they might not like that, falls on deaf ears, especially if I'm a young person and I get reciprocated.
Right.
You get kind of, all right, yeah, whatever, Mom, Dad, or Miss Joy, sure.
Yeah. Yeah.
I'll take the 10 rejections for that hug I just got. Right.
Mm-hmm.
This is actually a great segue, and I'm going to come back to are the social skills groups that I run. And sometimes it's in group therapy, which is an unnatural environment for natural interactions. This stuff will come up. And so the difference will be is I'm not, I don't say, no, you can't do that. But when someone does this to the other member and they do that, I say, hey, hold on a second. And I'll say, Joy, I noticed you just recoiled. What was going on there? And you might say out loud to the group. And I said, Joy, I want you to tell John, Darius, tell them what that was like for you. And then I have the other member. I said, what did you see there? John lunged at her. She looked scared. I wouldn't like that. So it's an unnatural environment, a set time, a designated space with a therapist for natural interactions. And sometimes that's where this therapeutic, a group therapy, can have really big impact for these types of.
That's true. Thank you.
Okay. So let me just check. Any more comments or questions that you're seeing, Jan?
No, we're good.
Okay. So the second tool or concept that I want to talk about today is basic. It's simple, but it's been really helpful, especially for a lot of people I work with who have organic social skill deficits. These might be persons that are on the autism spectrum, and even the art of conversation is baffling. So it's not the anxiety piece. These people might not even be anxious. If this is you, you might reflect and say, I just don't know what to say. And so let me pull up. This is, so I'm kind of looking over my computer again. I'm going to pull up my worksheet this time. All right, and then let me come back to my Zoom and share. Okay. So I teach in my groups and individual consultation that there are 3 basic parts of conversation: question, share, comment. Now, for the person who is good at math and science and analytics, but conversation baffles them, it can be very helpful to have structure, to have rules and guidelines. So, and we'll draw on this in my groups too. We start off our groups becoming aware of our nonverbal presentation, how we're on the camera or in person, how we're presenting, looking at each other. And we start off our groups by just having conversation starting off. So what I teach is you can start a conversation with anyone by asking a question or sharing. That's what I teach in my group specifically. What I would say universally on this worksheet is what I have is the possible combinations of starting a conversation: asking a question, share and ask a question, comment, such as that compliment you mentioned earlier, Joy, and share, or comment and ask a question. And if you're seeing this and say, well, this looks like math and it's annoying, that's okay. This isn't for you. This is for the person that this makes a lot of sense for. It is helpful. And if this doesn't make sense to you, but you think it might make sense for someone that's important to you or a child, then this might be a helpful tool. So again, I'm going to start with brainstorming ideas of what are these questions. In my group therapies, we're not going to talk about it. We're going to do it. If someone is stuck, I might ask them, are you stuck? Yes. All right, well, I want you to look at someone else in the room and ask them for help. Now, when they do that, they don't only realize it, but they're actually looking at someone and using their name and asking a question. We're starting. So I teach parts of conversation. And I'll come back into some examples or do some Q&A here. I want to shift down to how to join or continue a conversation, because it's the same basic tools. Ask a question, share an experience. The only difference in continuing the conversation or joining a conversation with other people is you ask a question on topic to what's being discussed. you share an experience related to the current topic. In my groups, we play a game called Don't Drop the Conversation. And all of us have these 3 tools. And usually in my group, I teach the 2 tools. I teach question and share, because a lot of my clients have kind of actually developed the crutch of a comment, like, cool, nice. And they actually rely on that as their main conversation. And it actually is a reason why their conversations die, because they comment but don't add a question, and they comment or don't add a share. So I offer this to you, and usually the comment is something that most of my clients already use pretty well. In fact, it's their only response, and that's why their conversations die. Y'all, this is simple, but for the person who this is meaningful for, it is profound. And so what I'm going to do is I'm going to open up questions here, and then this will segue into me talking a bit more about the peer process social skill groups that I run, and also talk about who might be a good candidate for that. And if you're interested in that, how you might get connected to that. Okay. So, and Jan, I can't see the chat. Do y'all want me to leave this up during Q? Actually, yeah, I'll do that. I'll leave this up while Q&A. If any, y'all, I invite any questions now out loud or in the chat. And Jan, I can't see the chat right now. So if you'll.
I will monitor, no problem.
Y'all, any questions here, thoughts, comments?
Nothing coming up yet.
Okay. Excuse me.
And just Scott is going to share these with me so that I can send them out afterwards, send out the handouts.
Okay. So I'm going to segue. I'm going to stop the share.
Okay.
Okay. So everyone, whenever these 2 tools, the Jen's method for making meaningful small talk. Oh yeah.
A question did come in. At what age do we try to practice this with kids?
Good. So Raphael, immediately. Greetings start when the child comes out of the womb. Face-to-face contact with adults, sing songs, peekaboo. This is pivotal for social development. So when does it start? Immediately. Children have been shown to be able to mimic parent behaviors as soon as 40 minutes after birth. But I think what might be more helpful is, well, how do we do it? Greetings start in the home. We model it. So remember, mimicry is one of the most profound teaching methods. Humans learn through relationship. You have to have trusted relationships to learn. If you question that, think about your own education and which teachers you learned more from. Doesn't always mean they were warm and friendly. I learned a lot from some difficult teachers, but they were engaged. So let me speak a bit more to this. In fact, I think my last in-person presentation, I talked a bit about how to reinforce social skills through childhood. So we talk about as early as newborns, face-to-face contact engagement as much as you can. And if you know, we're in Northern Virginia, if you're getting up at 4 o'clock in the morning and getting home at 10 o'clock, when your child wakes up in the night, make an effort to go in, be the volunteer that goes in there. If it's just the weekends that you have, maximize it. So get it when you can. Face-to-face contact is pivotal. With greetings, it's in the house, it's in the morning, it's when we walk into the same vicinity. And if you model this, you do it. And in addition, you explicitly teach. Right? So when I referenced my example of my daughter at the playground, she doesn't see me scream at the other people. She's not, I don't think so anyway. So when she did something that was outside of what I want for her, then I pull her aside, right? I'm engaged, I'm here. And here's something pivotal. I do this in sessions, I teach parents this. Don't go to teach until you have engagement. You notice the first thing I say to my daughter is, hey, I want you to look at me, look up. Now, if I'm rushing that, I'm inducing anxiety, I'm creating stress, and now I'm having conflict. I'm direct and compassionate, and I'm patient. Perfect. Wait, so let me finish this thought, Diana, and then I'll jump there. So when we're teaching direct, compassionate, explicit, make sure you have engagement. And I ask a silly question. I say, can you hear me? Yes. And what it does is the verbal actualizes the neurological engagement. She's open for reception. She's open for receiving. And that's also useful for giving advice. Even as a therapist, I ask somebody before I give them advice. I have a thought on that. Is it okay if I share it with you? I think I have something that could be useful. Is it okay if I tell you about it? Because if we give advice or instruction before people are ready, it falls on deaf ears or it becomes irritating. And Raphael, just when we think about those greetings I talk about within vicinity as early as you can. And you model that as well. You go for a walk with the family, someone walks by, you look up and wave. Mimicry. If it's a specific issue you know your child struggles with, then you give explicit instruction. Preferably not in the moment, in a calm place that's not anxiety inducing. All right. What do you say to a child that constantly interrupts the flow of a conversation? So one tool that I use and I'll offer to parents is the playground protocol, okay? And what you do here is, and so Diane, I'm using this because I'm referencing your question here. So playground protocol is if your child struggles socially, then you go to a playground, and this might be more difficult with COVID, but the light is at the end of the tunnel. It's coming. We go there and I send them out and I watch them. So I'm not on my phone, I'm not reading. I'm intentionally, with a researcher's eye, you're watching your child. And you're going to give them 20 minutes. So that actually might be the instruction you give them. You say, hey, in 20 minutes, I'm going to come grab you just for a few minutes. Don't worry, we're going to play again. Right? So if you deal with the upset, you want to go ahead and prep for that transition. And I'm going to grab you and talk to you for a couple minutes. Send them out there, watch. So whether it's interrupting, whether it's monologuing, whether it's being too close to others, we pull back and we debrief. Hey, whenever you're debriefing, you always praise first, right? Sandwich method. Praise, critique, praise, send off. Brief to the point. You don't want to be too long-winded because you're at the playground, remember, okay? So that would be one style, Diana, is the playground protocol. 20 minutes, pull in, 5 minutes is too long. Less than 5 minute debrief, praise, critique, praise, and give them an expectation. So, hey, when you're talking, wait for the pause. You can do it. Let's see how it goes. Send them out. 20 minutes debrief. Don't do this every time you go to the playground. That's annoying. But do it with intention. And depending on the need, you might do it once a week. You might do it twice a week. Now, again, if you only go to the playground with the child once a week, do not do this every week. If you go 2 or 3 times, do it once a week. Okay. So what do you say? Compassionate and direct. I'm noticing this. And I ask, are you noticing that? Hey, I noticed when so-and-so was talking that you kind of jumped right in. Yeah. Did you see that? No, I didn't. Okay, I want you to pay attention to it. Send them out. In the house with you is probably a good place to it. Hey, hold on a second. And you might have to pause. They might keep going, right? Hey, hold on. Hey, I'm really interested, right? So I'm really interested in what you're saying, but I was mid-sentence. Can you hold on and let me finish? This empathetic, direct, and compassionate approach solicits learning. Shut up. What are you doing? I was talking. Yeah. Now, if I'm saying this and this perhaps was you today, this is not critique of you. I truly believe that as parents, we're doing the best we can. And when we know better, we can do better. Yeah. And my best parenting, I'm not on my A game all the time. So part of being a good parent is having grace and compassion with yourself as well. Okay. So Diana, I was long-winded there. Is anything I'm saying there helpful, or do you have a follow-up question, maybe a clarification question for me? Maybe give me an okay, or if you have a question, go ahead and jump that in. Yeah. And so, and I'd say that it's important to be great, have that grace and compassion with ourselves as well. And when we do that with ourselves, it actually becomes easier to do that with others. Starting with yourself is an important part. In fact, I want to give a disclaimer. If when you come out of here today, you're thinking, oh, dang, I need to do something different. Grace. Give yourself grace. All right, this is helpful. I can try this. Yeah. Grace with ourselves, compassion with selves breeds grace and compassion for other people. Okay. And Diana, that's a great segue too. If don't put this all on yourself. If this is a persistent chronic issue, you might need support. You might need professional intervention. And so the groups are a great place to do that because again, it's an unnatural environment for natural interactions. And so this is my specialty. This is what I train to do. This is what I read about, study, and practice and reflect on. And so it's kind of my bread and butter. So these are the types of things I do in sessions. So when I think about understanding it, it really depends on the level here. So if I think about difficulty with social cues is different than not understanding. Maybe a young child or a person with a cognitive delay doesn't understand. Maybe my hyperactive child understands, but the impulse, they really want to get out there. So one, I do explicit instruction again, so preparation. This is great for the playground. Good question, Joy. So if you're taking your child to a playground, a family event, you want to prep them beforehand. Again, clear expectations. And the other thing I do is I want to normalize it. I don't want kids in this generation thinking it's strange that they want to touch other kids. I don't want kids in this generation. Wait, which one is they? Oh, is that something different maybe? So I want to normalize that they want to touch other kids or be close to other kids, especially in this COVID kind of generation we've been in. I don't want kids thinking that something's wrong with them because they want to be close to other people. So I want to normalize this, reset. This is a strange thing called a pandemic, and it won't be forever. Right now, when we're out there, I want you to keep a distance. When you're on the slide or when we're, you're playing, these are some things we can do, but you're not allowed to do this. And then the thing that you're going to have to do is you're going to have to intervene likely. And so again, compassionate direct, compassionate assertive. I pull aside. If it's unrealistic, then I might say, hey, if it's the park, I might say, we're going to take a time out on the bench. Or I might say, we might leave. Usually I'm going to give a correction and give them another chance. But that's also going to depend on kind of your risk tolerance as well. Okay. All right, let me look down here, Kim. So conversation quickly ends because nothing much for discussion because boys are home, school is online. What else for suggestions? So this a quip I come up with is if in the last week you have nothing to talk about, then life's pretty boring. You need to get out and do something. And so that's kind of, I use that lightly and depending on the relationship I have with the person I'm talking to. I don't want to shun or shame anybody. In my experience, it's just not accurate. Because when we move past what we're doing, I'm online, to what's going on, what I'm interested in, what bothered me, life is rich. I've met with a client this week who is his parents are astounded that he talks to me for 53 minutes every week. And I tell you what, I sat with this young adult for probably 7 or 8 sessions in almost silence. And I had to do a lot of work to not fill the void. Boys, and I think I might be tangential. I want to come back to trying to really assist with this question, Kim. So in general, I'm getting Kim that conversations end. There's not a lot going on. It's been mundane, but not enough sharing to friends. And I'd say it might not just be your son, it might be issues across. So, it might be difficult with the other kids communicating as well. So I would go back here, Kim, to those parts of conversation. So like if I share something, and what I teach in my groups is share and pause. Sometimes somebody's going to follow up. If you're dealing with other people that struggle socially, you don't know what to say or disengaged, I share and then ask an on-topic question of what I shared. Man, I watched this killer movie this weekend, and I pause. Some people are going to jump in, follow up. If not, I'll say, have you seen that? Or what have you been watching recently? So Kim, this is for this specific question, the parts of conversation and teaching kids how to pair that together. Because in any pause, if you ask a question or share, it's a way to move through those pauses. Other thoughts, questions, comments, or concerns?
I was going to say something during this time of COVID too, is we just had a movie night on Wednesday night, actually in person. We rented out the actual theater, which was really cool. And some of the parents came with their son or daughter, and everybody was spread out, had to wear the mask while you're at the theater unless you're eating popcorn. So, but afterwards, it was different. We haven't been in person, so it was very different. And it was difficult trying to get people to understand the distance and with each other and around our staff and stuff. So it was very tricky. I noticed, even if it was just for a little bit in the beginning and a little at the end, because everybody was watching the movie during the middle, and having their own seat. So it's going to be difficult when we do go into person, and how we, remind people. It's reminding them that, got to keep your distance,
And where I think it's, I don't envy teachers or people that are facilitating larger groups. It's very different, to be responsive to, when I talk about giving explicit instruction, intervening
Right.
On the large end of family of 4 or 5 kids.
Yeah.
You got 8, 9, 10 kids, or you're responsible for 10 or plus. That's another ball game. And I'll be frank with you, that's going to be outside of my skill set.
Yeah.
I'll handle that. I don't supervise more than about 8 kids at a time.
Right. Small group.
Diana, you mentioned something about the dog park, and that's something I bring up with socially anxious teens a lot, is the idea of using something like walking your dog or taking your dog to the dog park as a gradual exposure. And so I'm glad you mentioned dog people are often social. Yeah. And you might be an unsocial dog person, but you can use your interest in dogs as a segue.
Just for a time reference, where it's 11:10. So, because I know you have limited time, we'll try to get off as close to 11:30 as possible. Okay. Thank you, Scott.
So what I'm going to shift to now is talking a bit about the groups I run. I've mentioned them as I've brought up topics or things that I might do in our groups. So my thought now is to kind of shift to talk about who might be a good candidate for the pair process social skills groups that I run. And so someone that might be a good candidate is a child For the virtual, I say at least 8 years old. I had in-person groups that I transitioned online of 7 and younger, and kind of gave the parents disclaimer. This is a new intervention. I have not done this before. Who wants to try this? We ran it for about 8, maybe 12 weeks. And I reached out, I said, I don't think this is a valuable intervention. I don't think I'm offering what you're looking for. And so we made a mutual decision with those parents to end that group. 8+, I've had great success. Kids are excited to show up. I feel like the clinical intervention is happening. Parents are happy with the results. So my virtual peer process groups, I run virtually. Historically, I run a younger group in person, and as well as another clinician or two offer younger than that in person. So children as young as 8 through adults. I work with adults who are professionals, who are speech therapists, occupational therapists, lawyers, doctors that struggle with anxiety. And so as young as 8 up to adulthood through the lifespan be appropriate for this. A question I often get is, do I have to have a diagnosis to participate in group? The answer is yes and no. And if you're seeing me through Psychological and Life Skills Associates, which is where I run my current groups, then yes, I'm going to interact with you. I'm going to do an intake. I'm going to assess. And if you want reimbursement through insurance, then you have to document and diagnose the appropriate diagnosis. I have some people that have subclinical, they don't meet full criteria for something that would reimburse for a weekly intervention. And I'm just candid with that. And there are things called V codes. And so almost all of us at some point in life will qualify for some type of stage of life codes. And I think, so there might be a writable diagnosis that's not reimbursable by insurance. It doesn't mean you can't participate. It just might be a reimbursement issue. But in my experience, if someone's coming to me because of trouble of connecting in school, it's causing problems in their profession or in their marital relationship or relationships, then they're going to meet criteria for a diagnosis. So who's eligible? You have to have diagnosis. What else comes up when people ask about my groups? Probably what to expect or what they look like. So my groups, I kind of build them and they're thematic. So typically most of my groups are stage of life and a clinical topic. So stage of life might be middle school. It might be adulthood or transitioning to adulthood. Young adults who are 18 to 22 in school, living at home, navigating to adulthood. It might be professionals with social issues. So again, think of often these are people that don't realize they have a diagnosis until they're in their 30s or 40s, usually because of partner issues. And they've done very well in a lot of ways, but their social skills are causing them problems. And so they come to me. So my groups will typically be thematic with stage of life, and also topics, social anxiety, trouble reading the room. Okay. I don't build diagnostic group. So I don't have a group for people with autism or a group with people with social anxiety, but I do kind of talk about the themes that I'm seeing and the rationale why I'm recommending a certain group over another one. So do you have a group for teenagers with limited verbal communication abilities due to speech issues? So let me see here. I have so I've got quite a few groups that are in the middle school to high school range. I have a group of high schoolers who are more kind of have deficits associated with autism spectrum, but less of the anxiety, but definitely low confidence affected them socially. But once they're getting the skills, they don't have the anxiety. I've got a high school group for more neurotypical teens that have significant social anxiety. And some of those students have speech issues. In some of my middle school groups, there's often a correlation with speech issues, speech impediments, and social anxiety. So I don't have a group, Jason, that's, hey, this is the group for kids with speech issues. But I'd say in three of my groups that I have through middle school to high school, there's individuals, multiple, that have some type of speech issues or work with a speech therapist. Since group work is about group fit, historically it would be calling in, me giving you feedback, and then moving forward. Actually, what I'm developing now is kind of an online tool that's a screener that will just be more efficient. That's kind of in the works right now. That makes it more easier for parents or other people that are interested to kind of click through some questions and let them know what groups are available or if there'd be one coming in the future. Yeah, great question. So talking about the group itself, what to expect in there. Typically setting the agenda with the group is something we'll do initially. I'll talk about what the plan is for today. If it's a younger group, question I typically ask is, do we want to do an activity or game today? The typical answer is yes. And so what do y'all do? For me, I'm open to using 15 minutes for a game. And especially for my younger groups, through games is a significant place for social skills intervention. So usually we set that first. Okay. And I'll say, well, I want to make sure we've got about 15 minutes, 20 minutes, however long, to make sure we each have a time to share and that we're responding to each other if anybody has any stressors, things that bother them this week, or even good news to share. So then I'm kind of setting what I want to make sure we have in the group. I'm soliciting feedback. This in itself requires social skills, talking, collaborating, compromising. Okay. And then we'll start the group, and this is what I call my open conversation time. And so I have I set my expectations for the group. I say, so my groups that have been going on know this. We talk about our nonverbal skills. So my general guidance is to have at least top of shoulder, the top of head visible. Keep your camera and mic on to generate the most realistic, in vivo responses to each other. I let them know that part of my job is that at some points in the group, I might pause the group and look at an interaction that's happening. And I explicitly tell people that in group, and I explicitly tell that at the beginning of each group. So I don't come across as abrasive or a nuisance. And so they kind of know that that's my role. And so we kind of break our group up into younger groups and activity, a time that we're going to share and respond to each other, and open conversation. Depending on the group, which of those general categories we're using varies and is more important. For people that struggle conversationally or joining in, having more open dialogue is more important. With my young adult group, we kind of half our time, and we know that from the top of the hour to 25 minutes after, we're going to have open dialogue. I tell them when someone asks a question, I expect all of us to respond to them. When someone's talking, I want us to look at them and listen with their ears. And we use those parts of conversation tool and give the entire group the responsibility of maintaining the conversation. And again, from a process group standpoint, I look for reactions, body language, and I stop and raise awareness. So the subconscious, we bring awareness to. And that also gets into the social emotional communication skills, assertive communication, telling people what we want or don't want, what we like or don't like. For people with social anxiety, one of the main things I'm intervening with them on is speaking up or having an opinion in group. Thoughts or questions? I'm sharing about some of this group therapy intervention.
Scott, when do you anticipate starting these groups again in person?
Great question. So my first check mark was myself, kind of my own risk tolerance. So right now I'm maintained virtual. I'm back in the office now. I'm just maintaining virtual. And so what I'm actually noticing, Jan, is I've got parents that are in DC or from anywhere from Fredericksburg all the way up to Alexandria. And when I had my groups, parents might get out of work in DC, drive home, pick up kids, come up, sit in my office for an hour, go back. I actually have a large population of parents who are interested in this continuing virtually. So what I'm in the process now is soliciting feedback from my active group members. I have other kids who the virtual has been helpful, but the in-person is going to be more pivotal in meeting their needs. And so I've actually been surprised at the usefulness of about the impact I've been able to maintain and continue to have using a virtual group. And there's also lots of perks for me, flexibility, accessing clients across the state, opening up accessibility. So I envision I'm going to continue to offer groups online, and then there'll be a select few groups that I do in person, likely with younger groups or with groups that's more relevant. You're talking about some of those issues of proximity, touching. All those things aren't getting captured in the virtual environment. And so I offer groups, Dr. Christopher Haley is my mentor and the founder of the Social Skills Center. It runs groups in person. And we have one or two other clinicians that are offering a subset. We have a psychologist that works with younger children that does groups. And we have another therapist that works with young adults that does groups. So Dr. Haley and I are the primary facilitators, and we usually have another therapist or two that are offering to a certain age group. But I didn't answer your question, Jan.
That's okay. That's okay.
It depends. I'm soliciting feedback, and I anticipate that in the fall, if kids are going back full time, there's not some unexpected surge of a new variant or something, then I'll be facilitating some groups in person.
Okay. Will those be at the Social Skills Center?
So great question. So I facilitate my groups, in-person groups in Woodbridge.
Right.
Dr. Haley primarily facilitates in Vienna.
Right.
And so we have an office in Fredericksburg, Vienna, and Woodbridge. Woodbridge is our main office. That's where we have our hub of therapists. So those are the two hubs to be Woodbridge and Vienna we're offering in person.
Okay.
Now I will put a plug here that our in-person groups are going to be facilitated through Psychological and Life Skills Associates.
Right.
And Dr. Haley and I are actually collaborating now, and we're going to be bringing on other social skills specialists. And the Social Skills Center, we're opening up nationally, and we're going to be facilitating as a non-clinical intervention. And what I mean by that is it's not a diagnosis required.
Okay.
We're going to be drawing on Dr. Haley's model that I've collaborated with him on. We'll be using a lot of our same skill sets. Our people that will be hiring and training will be people with a therapeutic background, but we're leaning more towards a coaching model. And so what this does is open up access for persons without insurance, or they don't meet criteria for insurance. They'll likely be more affordable. And it's going to open this up nationally. So we're kind of launching that website and that platform currently. And that's going to be the Social Skills Center. So if you check out our website, you'll notice that Psychological and Life Skills Associates is what has our in-person group information. And the Social Skills Center is going to be this platform for a national virtual social skills intervention.
Okay. Any other questions for Scott? It's a quiet group today.
So y'all, I really appreciate everyone coming and attending. I appreciate the questions that were asked. Now, Jan, you mentioned you'll be able to share documents, and I can share kind of my information in that as well.
Yes. Just email it to me, and then early next week, I will send out a link to the recording, copies of all your handouts, etc. So everyone, whether you feel like this is useful, you want to take it home. If you have follow-up questions, use my email address. I've got a robust schedule of people that I'm currently working with, but I've got community members that will send questions.
and I'll I'll kind of respond to them throughout the week. Feel free to reach out to me if you have questions. If you have questions about accessing services or intervention, or if the services that I offer might be a good fit for you or someone you know, definitely you can reach out and ask those questions. The last thing I want to address is sometimes people tell me, asking, well, what's the quickest way to get in with you? If I want to get myself or my child in with you, what's the most direct way? The most direct way is to call my admin team, and I'll make sure that number's in there, and I'll plug it into the chat as well. But so they answer the phones Monday through Friday, 10 a.m. to 4:30. And what they do is they jot down a few details and then they forward it over to me. And what that does is it lets me know if I have a current group that I think would fit for you. Or the other way that I develop new groups is that people reach out to me. I don't have a good group fit. And I'll let everyone know that I'm not going to put you in a group or your child in a group that I don't think is a good fit. But I keep an active wait list. And so I say, okay, this person's looking to get in, or I'm seeing this person individually that wants to get in a group. This is going to be I got 4 people here. So then we start a new group. So to get in with me, call my admin team. They'll ask you a few just basic questions. I'll screen it. And then I have a slot weekly that is open to new group clients. And so what my admin team will typically do once they get your intake document from you is they'll schedule an intake and 2 follow-up sessions. And what I'm doing there is I'm doing my mental health evaluation. I'm getting to know you, what you're coming in for. And I'm also doing that group prep work, prepping you for participating in group therapy. I'm making sure I'm deciding which group is going to be the most advantageous for you and for the existing group. And that's the most direct way to get in with me. Other people prefer to kind of email me first and ask me questions. You can always do that, but then you're going to go back to the admin team and schedule your intake, and then we'll get in. And let me just plug in. Jan, I'm going to give Jan the information for our practices, but right now I'm going to plug in our office number, 703-490-0336, extension 0, Monday through Friday, 10 a.m. to 4:30. And what I love about our team is we're intentional about having people that answer the phone. So we've got staff that answer the phone Monday through Friday, 10 to 4:30, and just definitely give them a call. Okay. Before we end, any last thoughts or questions before we end today's meeting? Excellent.
I just want to say thank you, Scott. I've never been able to actually sit through one of your sessions because, I'm always at the conference, I'm always running around with everything else. So I really enjoyed this. It was some good information.
Good. Well, I'm glad I got to sit with you today, Jan. Usually you're bustling out and about and
Yeah.
So Rhonda, I got to interact with you and see your face today. Joy, I think I've seen you before. Everyone else, I'm seeing your names. I'm not seeing your face. But definitely if you want to make further contact, if something here is useful or you have more questions, feel free to reach out to me. I'll plug in my email here now. And additionally, it'll go out with Jan when she sends out those links and things. So smiller@psychlife.net. That's the most efficient way to communicate with me. I do have an office number. And when you call our main line, it's an extension. But the most easiest way is email because I'm doing my virtual meetings. I see in between sessions. That's probably the best way for me to get back to you.
Okay.
It was a pleasure, everyone. Thank you very much for your time. And perhaps we'll connect in the future.
Thank you so much, Scott.
Thank you. Bye.
Bye.